Welcome everyone to this session of the CPS Speaker Series. My name is Miriam Hewitt. I'm Assistant Director at the Center for Public Service. And today's workshop is on monitoring and evaluation for community engaged scholars. It's a pleasure to introduce Tom Chappell, who's going to facilitate it. Tom's currently a Senior Evaluation Fellow with the CDC Foundation and a guest researcher at CDC. Before semi-retiring from CDC in May, he had served at as CDC's first Chief Evaluation Officer since 2001. He and his staff were a central resource for CDC programs and partners on planning, performance measurement, and program evaluation. He and they taught classes and webinars on these topics, developed tools for self-guided work, and most importantly, did a lot of personal consultation with programs and organizations needing this coaching. Tom is parent to a Tulane graduate and a current Tulane student, and he's been doing trainings and consults for us and the New Orleans community organizations since 2012. Tom, I'll pass it on to you.
Great. Thank you, Miriam. Yes, as Miriam said, I've been doing some work with Tulane for quite a few years now, and most of that work's been through the Center for Public Service, where I've been working directly with community-based organizations that the center interacts with, either because they have interns there or they do some other kind of work. That kind of toned down during the pandemic just because I was doing a lot of it in person and we couldn't meet in person. Then when I contacted Miriam, it sounded like there's a similar need from people who are interacting as faculty and students, et cetera, with community-based organizations, but who face the same kind of issues I did with the community-based organizations, trying to give them a practical way to think about evaluation and continuous program improvement. So this is really similar to the dilemma at CDC, where we have a sense of what we'd like programs to accomplish, but we often fail to check in with the client program to see if they agree with us, come to agreement on what outcomes we're trying to achieve, et cetera. So the approach I'm going to teach today is one that's been pretty simple and practical and very useful at CDC and works particularly well with people who are not interested in scientific evaluation, but evaluation for purposes of staying on top of their program and trying to make it better. And I've got a lot to go through. So though I usually like to bring some cases and have you work the cases, it's more important I get through all the material. But as Miriam might have announced in the promotion for this, if this approach I'm going to do today looks like it's useful for the program you're working with, I'm happy to talk to you about doing a facilitation with you or doing a facilitation with you in that program. Okay. So today I'm going to talk about the CDC evaluation framework steps and standards. There's nothing magical about our framework. It's one of a whole bunch of approaches to what's called utilization-focused evaluation that became common in the late 90s. I'm going to talk about the central role of program description in frameworks like that, and particularly logic models as the most common forms of program descriptions. But I'm going to use really, really simple logic models, which I think solve 80% of the problem and which really makes this much more accessible, since it's often where people lose interest and get fatigued is the complexity of logic models with 8 different terms, et cetera. I'm going to get into those terms, but I'm going to get into them in context, and you're going to see how terms like inputs, outputs, mediators, and moderators are actually useful, when they're useful and how they're useful for helping with this idea of program description. And then the main part is to show how the time you invest in getting this idea of the program's roadmap correct, it makes it so much easier to engage your stakeholders, set an evaluation focus, and do a host of other things we're not going to get into today related to planning. Right. First, defining terms. I'm not the author of the CDC framework. I'm one of about 200 people who kind of helped develop it back in the late 90s. The problem CDC faced was not that people didn't do evaluation. It's that when they did it, it didn't make a difference. Almost never were the findings used to either cancel a program, improve a program, endorse a program. It was done primarily because someone said you had to do an evaluation. It took a lot of time and effort. We thought evaluation would die as a profession, and so we scouted around for a way to save it. And the first thing we figured out was that people were defining evaluation and program both too narrowly. So they were thinking of evaluation as a set of methods, primarily scientific methods that look very much like the typical science research design, which is perfectly appropriate for a lot of programs, but not appropriate, often overkill, and often stresses beyond the skills, ability, time, and energy that a program has in many, many cases. So we found this definition of evaluation, that it's not about methods, it's an orientation to being systematic about thinking at any point in time about merit, worth, or significance of anything. That came from Michael Scriven, who's one of a few household words in evaluation. Likewise, people didn't believe they needed to engage in evaluation unless they had a program, but they tended not to think of a program unless they had something really big and bold and nationwide, et cetera. We wanted everyone to think evaluatively, and everyone to think that they had a program, so long as they had a set of activities they were doing. There was an outcome in mind for those activities. And if they did those activities right, they'd get the outcome. If they didn't, they wouldn't. And they were interested in why they got it sometimes and not others. So we wanted everyone to have an evaluative orientation to what they're doing. The reason we cared about this is what we call the continuous program improvement cycle, or continuous quality improvement cycle. Most programs at CDC, and perhaps the programs you deal with, do at least a modest amount of planning, performance measurement, and evaluation. But they tend to do these in isolation. Poor evaluation gets done because it shows up on page 5 of your grant, and it may or may not relate to the statement of work for the program, and it may or may not relate to what someone else is asking you to collect as performance measures. There's nothing wrong with that. You don't want some poor slob to have to own all 3 of these processes. But when you do them in isolation from each other, you make each one of them harder, and you lose a lot of opportunities for them to feed each other. What we wanted to do with our evaluation framework was for people to see program improvement as this continuous cycle. Starting at the top, what do we do and how do we do it? How are we doing, which is the performance measurement question. And then the evaluation question is diving in and figuring out why we're doing well in some cases, poorly in other cases. But then the most important thing is that that loop gets closed, and the findings from how are we doing and why are we doing well or poorly comes back to feed what we're going to do, or what we're going to do next, or how we're going to do it. It seems so obvious, and yet in reality, in large programs, you've got people in one set of cubicles doing planning, another set of cubicles doing performance measurement, and another set of cubicles doing evaluation. And often they don't talk to each other because they're basically reporting to a different set of gods. All right. Oops. There we go. Right. Now, Michael Patton, the other person who's as close to a household name as we have, says all of what I just said by saying research seeks to prove, evaluation seeks to improve. Right, or really seeks also to improve. Once you realize that the purpose of what you're doing is to actually change the way in which you do the program, then it kind of sets in some ways a higher bar for evaluation, because not only do you need to collect the data in a valid and reliable way, you need to collect it, report it, and do it in a way that's going to make sense to the people implementing the program. And that's a pretty steep bar in many cases, and you lose more than once, you lose a client on that way because it gets too complicated, right? So CDC's framework. This is a 1-page summary of the 6 steps and the 4 standards in our framework. And you can see how it's inspired by this idea of a continuous program improvement. If you follow all the way around that circle, you'll see, starting with engaging stakeholders, we end with ensuring use and sharing lessons learned. And that is the big change. That was what we wanted to do with our framework, was do evaluation in a way where someone would actually use the results to make a difference. In the old days, we did evaluation, as I said, but evaluation tended to be good evaluation when it concentrated only in the lower half of that circle. You came up with plausible questions in your focus, and then it was a good or a not good evaluation based upon how are you collecting those data, how are you analyzing those data, which is not unimportant, but doesn't necessarily lead to use. And as I said, maybe 1 in 10 times did we see all of that work we put into asking a question, collecting the data, justifying the conclusions by analyzing the data, turn into actually use of findings. So we wanted to change that. And it wasn't just us. The entire field of evaluation was feeling this need to make evaluation more practical so people would actually use it day to day to make a difference in their programs. Well, the first thing we and everyone realized was we needed to own that 6th step as the intent of evaluation. And so the first thing we did was said, good monitoring and evaluation, M&E, is evaluation where the findings are used or the findings are based on use. Right now, it glides off the tongue, but the reality is once you commit yourself to this idea of improving, not just proving, everything else changes. Because we all wanted to get there. Well, what the heck were we doing wrong that we weren't getting there? Well, we and everybody else thinking at the same time said, what we're doing is we're screwing up the focus point. We're assuming any plausible question is the right question. Well, now that we know we're in the improving business, we realize the most important questions are the questions that matter to the people implementing the program. Now, it's not uncommon for us at CDC and for our clients to whom we give money to have the same questions in mind, but it's also not uncommon for us to have completely different questions in mind. And you can see how you're not going to get to use unless you're asking questions that matter to the people that matter. And so this is a matter of creating sort of a market for the product being the evaluation, the market being, these are questions that someone really cares about answering and really wants to do something with those data. Again, really hard to dismiss this as a goal. The question was, why weren't we getting there? And that's where these early steps came in about engaging stakeholders and this idea of program description, which is so important, even though sometimes as logic models, it gets overdone and over-engineered. Like I said before, you would come up with plausible questions in your focus, and then you would decide to collect the data correctly, analyze the data correctly on those questions, and you would get use 1 in 10 times, right? What we said was missing was we failed to ask what questions mattered to the larger scheme of stakeholders, all right? People with a vested interest in the program, whether in its success or its failure. And then most importantly, and this is really the key thing, I think it's the single biggest innovation in utility-focused evaluation, is the step of describing the program, not describing the evaluation, which we always used to do and is not unimportant, describing the program. A lot of evaluations don't get to use because no one sat down and said, does everybody that's important for this program agree on what the program does, what the program's trying to achieve, and which of those outcomes constitutes success? It's hard to imagine that people can be working on the same thing, sometimes for several years, and have different opinions, but in fact, that is still the case. When I walk in and start an evaluation or strategic planning project, the first thing I do is some very simplified roadmap, as I'll show you in a second, and sure as shooting, you'll find that in the course of doing that, 2 or 3 competing theories about why the program's supposed to work and what's important will be in the room. And you can see how you can't get to use because you can't really get to the right questions until everyone's agreed and has some clarity and consensus on this thing called the program, right? So step by step, we do these steps as 1, 2, and 3. The reality is you can do these steps in any order you want to. I would still say I start with number 2 in most of my engagements because I find describing the program at a very high level is an easier way to engage the stakeholders, then do those 2 things to decide what should we focus on as evaluation questions. In other cases, I walk in, the client has a lot of energy about certain questions. So we're really starting with step 3. There's nothing wrong with that, but I don't let us go to data collection until we make sure that the questions being asked in step 3, the ones that have highest energy in their mind, makes sense when you look at the whole program. Often when you look at the questions and then you map them to the logic model, you see, oh my gosh, all these questions are about implementation. Is no one going to care if you don't get your outcomes? Or in other cases, more often, all the questions being asked are about the outcomes. Well, unless you're sure you're going to get your outcomes, you better have some process evaluation to figure out why you didn't. Right? So any one of these 3 steps can be your starting point, but you got to touch all 3 of those before you get escape velocity and head to the next ones. And these, notice, are really very similar to any data collection project we do. Number 4, gather data. Number 5, analyze data. Number 6, report out the data. But notice we don't call them those things. We call them something different because our theory is if you do a really good job at these 3 steps, these become way easier or much more likely to lead you to a successful result. So we don't call it gather data, we call it gather credible evidence because you know from steps 1, 2, and 3 what kind of evidence people are looking for. More than once on my projects in the old days, I would find that I collected all this quantitative data only to find out that people felt quantitative data was too narrow and it didn't have the flexibility of qualitative data. Just as often, I'd collect all this great qualitative data only to find out that people only trust numbers. You don't have that happen when you get to step 4, when you do it our way. Number 5 is not analyze the data, it's justify conclusions, because you already know from steps 1, 2, and 3 from the start, what's the prism someone's bringing. It's hard to imagine there was ever a world where we didn't care about equity, diversity, and disparity in outcomes, but that world did exist. And so you would go through with a project, you would find out that the program was working great in aggregate. The first question out of the box would be, is it working the same for males and females? Is it working the same for people of different ethnicities? Well, at that point, it's too late to unravel that. So you know from the start, are people bringing a disparities lens to it? Are people bringing a zero defects lens to it? Are people bringing a cost lens to that? And so you know when you're justifying conclusions, you know from the start which frames of reference you need to be. And then, of course, the biggest change is we start from the beginning with use in mind. And so we're thinking in step 6, not about how to report out the way the format in task 21 of your statement of work says. We're thinking, who's the market for this? What are they going to do with it? What's the best way to package the product or products by which we report out what we found in steps 4 or 5? Right. So the last thing that's special about this, and again, all of this is framework just to sort of set up what the shift was from doing the more scientifically oriented evaluation that we did in the past, is the evaluation standards. So I inherited these and I really didn't know what the heck to do with them. And it took me a long time to figure out why they were even there. We knew they were central because they're at the center of the framework, but I wasn't really sure what to do with them. It looked like we already said in the steps, how do you do an evaluation? What are these standards for? Well, over time, I realized how important the standards are, because they don't tell us how to do an evaluation. Rather, what they do is they limit or expand the options. So we're choosing the right set of options at any one of these steps. So you have 100 stakeholders for a program. When you use these standards, that helps you narrow down to which stakeholders are more important for this evaluation of this program this time. A logic model can have 5 boxes, 10 boxes, 500 boxes and arrows, right? The standards will say who's going to do this. When you look at the standards, what does that logic model need to look like? How complex? There are 50 viable focuses for a reasonably complex project, hundreds of ways of gathering data, etc. The standards say, look, every evaluation is situation specific. When you ask these 4 sets of questions, you'll decide for this evaluation this time, this is the best options for each of these steps, right? There are 30 plus standards, but they fall into these 4 groups, and I prefer to use them as 4 global questions. Utility is the most important one. We call this utility focused evaluation for a reason. Who needs the information from this evaluation, and what info do they need? Why? Because we're in the improving business. And so that means we always have a user in mind. Feasibility is second most important, because what often killed evaluation was setting up a very high research design bar, which no one could meet. And so they would do nothing. Not they would do something short of a research design, they would do nothing. So feasibility says, how much time, money, and effort can we really put into this evaluation this time? Propriety front and center these days, because it's all about equity and et cetera, et cetera. Are there things we need to do to be ethical about this? Are there questions we need to ask? Are there methods of data collection we have to stay away from or be careful about? And then poor old accuracy is last. And it's not, and I inherited these in this order, but I would have put accuracy last, not because accuracy is unimportant, but in a science agency like CDC, accuracy is often the only or the king of the standards. And when you apply that peer review accuracy lens, what you end up doing is limiting yourself to questions you can prove validly, reliably, and accurately, which almost often is nothing that's going to matter to anyone who cares about your program, right? So what we say now is say accuracy is last, because accuracy is the servant of these others. And we say to ourselves, who needs this information? What are they going to do with it? How much time, money, and effort can we realistically put into this? Then we say, is there a design we can come up with that's accurate enough to meet the needs of that user and yet falls within the bounds of time, effort, skill, etc. Now, sometimes these 4 standards interact to tell you you are not ready to do an evaluation. You shouldn't even do the intervention. If I'm doing a 5-year study of survival rates for a new cervical cancer treatment, well, utility is obvious, but feasibility and propriety tell me, look, I can't do this unless I have the money to do a randomized control trial, or the 3 steps that you go through in a randomized control trial for the FDA or whatever. And if not, then the accuracy standard tells me, not only don't I do the evaluation, I shouldn't do the intervention. But you'll see in the case I brought with me, and in a lot of the stuff you're probably dealing with, that when you ask who's going to need the information, how much time, effort can we put into it, you'll end up with, this does not really call for a research design. It doesn't call for a comparison group. It calls for some relatively straightforward information to tell us we're headed in the right direction or not. Okay, now let me stop there and make sure that people are with me, because that's the basis and the underlying fundamentals of the whole approach we're going to take. So I need people to understand what I'm saying, or let me repeat it if I've spoken too quickly, and agree with what I'm saying, or let me convince you otherwise, because this is all going to build off of what I just said. So let me just give 10 seconds for someone to type into the chat something they need for me to repeat, or something they don't agree with. Okay. And then Miriam, remind me, we have to 1:30, correct?
We do. Yes, correct.
Okay. And there's one person in the chat. Propriety. Okay, yeah. So propriety is typically a fancy word for ethics, for the ethical things. And so there's ways you can fall apart on propriety in a lot of ways. And these are getting a lot of publicity. There's a huge conversation in evaluation, doing more good than harm, and making sure we do more good than harm. And it's folding into the DEI discussions, et cetera. So propriety really just means, when I look at how I'm going to conduct the evaluation, are there things I need to be careful about to be ethical? So it's easy to think about, especially in data collection. So for example, your data collection should do no harm. Well, I used to do a lot of work with refugees, and I did a lot of work with immigration, like TB, et cetera, which is a really big problem among immigrants, especially illegal immigrants. Well, you can understand the data collection I'm going to do has to be very careful to protect their anonymity and their status, or A, no one's going to participate in the intervention, or the fact that I'm helping cure their TB ends up getting them deported, and it hasn't done any good for anybody. The other part, and I don't really agree with this, but I might be in the minority, is paying attention in propriety in your logic model to the negative consequences of the program. I can be persuaded this is really a big thing to pay attention to, and I bet someone can make a really persuasive case for that. I don't find that to be terribly helpful. When I look at the way I frame outcomes in logic models, almost always they're framed in ways that are aspirational, like ideals. But others would say, yes, you need to be clear that the program can do harm as well as good on the outcome side. So that's what proprietary means, right? Okay, now let's turn to how we get into this. So again, like I say, you can do these in steps 1, 2, 3 in any order. I find over the years, it makes more sense to start with this idea of program description, all right? So a lot of people have Pavlovian responses to logic models because they've encountered them in situations where, to my mind, they've been preached dogmatically, where you're given a format without any explanation, or you're doing it because it says on page 4 or 5 of your grant, you have to have a logic model. So what I always emphasize is you don't need a logic model. What you do need is a program description, because people get turned off by these 4 columns or 5 columns, or these terms or these 8 terms, and then they don't do anything. And so they miss the value of program description, which is absolutely essential if an evaluation is going to lead to improvement, right? So whether you do a logic model or not, you need to understand those 4 things. What's the need your program's trying to address? What's that right-hand distal outcome? At CDC, it would be improving health outcomes, improving quality of life, reducing incidence and prevalence. And there's a million reasons. I teach a class on using logic models and strategic planning. There's a million reasons you want to understand that need, but typically it freaks the heck out of the people who are your clients, because they think the act of writing that need is the act of being held responsible for it, right? You'll see in a little bit that there's a million reasons I want you to understand you're in the morbidity and mortality or incidence and prevalence business, but that isn't the same as holding you responsible for changes in that. The second thing you want to understand is, to get to that need, it's almost never a function of what I do as an organization. It's almost always what I do as a program has to move a bunch of people who are not me to take some action, which may in turn move a bunch of people who are not them to take action. So we call those people target groups or change agents. I don't know, you call them whatever you want to. But the important thing is we call the actions they take outcomes. So in our parlance, outcomes are changes that happen in someone or something other than the program. What the program does is activities. So I have under my control a certain amount of resources, staff, et cetera, and I implement these activities. Those activities, if they work their magic, move people who are not me to take action, which we call outcomes. And that's what gets me, at least partially, or makes a contribution to this big thing called the need. All right. Now, this usually leads to 4 or 5 columns, and often that's just fine for program description. In fact, one of the things I always caution people on, we'll do it today, is when you get to that simple 4 or 5 columns, ask yourself, do I have all the clarity I need to have this conversation? Today, I'm going to show you why it makes sense often to add that 5th step, which is putting in some arrows, which is why logic models tend to look like a flow charts in a lot of ways. And that's to pick up what we call the causal relationships, but causal in quotes. It's not what does the theory show or what cause have I proven. It's when I'm describing this program, what do I think leads to what? So I prefer the term program theory. You may know it as theory of change or whatever. All right. So those 5 steps constitute program description. The first 4 often suffice, especially when you're doing this for purposes of improvement in strategy. Adding that 5th step often makes a lot of sense. Okay. Logic models, world's simplest definition, graphic depictions, pictures of the relationship between your activities and your intended effects. And I bolded those 2 words because that's what's core to the act of doing logic models. Logic models don't depict the complexity of your program, although they can do that and they're helpful, but typically you would use process diagrams or whatever, decision trees to do that instead. But decision trees, process diagrams don't ever tell you anything about the so what of your program, just the what of your program. And logic models are trying to show the relationship between the what that you do and the so what that should result. Now, I underlined intended effects or outcomes or impacts, or whatever term you were raised with, because logic models are always aspirational. At any point in time, I'm saying, what am I doing and why am I doing it that way? And in a picture, can I draw what these relationships are? What that means is logic models start discussions. They don't end discussions. The logic model I come up with today, after I do evaluation, school of hard knocks implementation, science or whatever, could end up very different because I'll find out from that evaluation that I'm doing or that analysis I'm doing or the monitoring I'm doing that parts of this program were exactly as I described them. Other parts couldn't be more wrong. And of course, the program, if I'm in the improving business, will change and the logic model will change with it. Right? Now, the reason a lot of people hate logic models or have loving responses to them are all of these different terms. Now, as an evaluator, I understand the value of these terms, although it took me a while to learn the value of all of them. But the reality is 80% of the benefit of this program description step comes from just those 2, the black and white boxes, not those green boxes, and particularly those yellow boxes. And that's where we're going to start. So when I'm working with a program, particularly a program reluctant to do evaluation or planning, or with a visceral hatred of logic modeling, I start from the inside out and I say, look, the first thing we're going to describe, and I call it a simple logic model, some people would call it theory of change, is what does your program do and who or what is going to change because of the program? And 80% of the value of program description comes from this, because when evaluations go wrong, it's often because people have not thought about the program in enough detail or come to consensus, and those errors tend to be not in the outside moderators or the inputs. They tend to be in a failure to understand the interrelationship between activities and outcomes. So that's where I always start. Before we're done, I'm going to show you how terms like inputs, outputs, and moderators help you flesh this out to your benefit. Okay, so here's a case I'm going to walk you through. If I had you longer, you would read this case and you would extract the logic model from it, et cetera. I'm going to use it instead as a teaching case. And if by chance you work in the lead poisoning field, fair warning, this is the way we used to think about lead poisoning, as primarily a secondary prevention issue. We'd find people with lead poisoning and then try and deal with ameliorate the effects. We don't do it that way anymore. We treat it as a primary prevention problem. But I love this case because I've been able to doctor it to put a whole bunch of minefields in here, which are typical of community-based interventions. So lead poisoning is a widespread environmental hazard facing young children, especially in older inner city areas, for reasons we'll see in a second. Exposure to lead's been linked to cognitive disruption and behavioral disorders, especially when that exposure occurs early in life. Now, as I read this, I want you to think of the what versus the so what. What does it sound like this program does, and who or what sounds like it should change because of the program? All right, the main sources of lead poisoning in children are paint and dust in older homes with lead-based paint. Now, those of you familiar with Flint may think it's water, and water, of course, and because of the age of our infrastructure, is taking on some importance. But the reality is that until 78, the main source of lead in the environment was gasoline, and we would find high levels of lead poisoning in everyone's blood. Once we took it out of gasoline in 78, the remaining people who got lead poison tended to be little kids in older homes, because those older deteriorating homes had lead-based paint and the kids were ingesting it through paint and dust, like kids will do when they roam around. Right? So that's why that's been our focus for so long. Little kids ages 0 to 3, especially ones who have access to eating or the dust from lead-based paint. Lead poisoning effects can be ameliorated through medical interventions, which are quite complicated, but ultimately the source of the lead in the environment must be contained or eliminated through renovation or removal of lead-based paint. And that typically, to be done well, needs to be done by professionals. Short of that, there's some things a family can do to reduce the bad effects on their kids through very intensive scrubbing the heck out of your house, your baseboards, housekeeping practices, and selected nutritional interventions, particularly eating the kind of iron-rich vegetables that children are genetically programmed to hate. All right. Now, here's the program, County X, because we usually give money to a county or a city with a high number of lead poisoned children. Now, through our algorithm, because we know enough about where lead occurs, we usually can say, hey, trust me, whether you're finding them or not, you got a lead poisoning problem. We're going to give you money to try and solve it. Right. So we gave money to this place because our algorithm said they have some lead poisoned kids. The program aims to do outreach and identify kids to screen and identify those with elevated blood leads, assess their environments for sources of lead, which almost always is their house, and case manage both their medical treatment and the correction of their environment. They will also train families of these kids in the selected housekeeping and nutritional practices I mentioned. Now, here's something important that'll come into play later. While as a grantee, they can use our money to assure medical treatment and reduction of lead in the home environment. They can't use our money to directly provide that medical care or directly renovate the homes themselves. You'll see that comes into play a little bit later. And I see a couple of points in the chat. Let me see if I missed something. Oh, I used to work in lead poisoning prevention and worked in primary prevention programs. Yes, that's exactly right. For a whole bunch of reasons that are beyond the scope of today's talk, there's a million reasons we went. And the difference for people who are not public health people, secondary prevention means you're mainly trying to ameliorate the impacts on people who have a disease. So if I find a bunch of older people with arthritis, I'm trying to keep that from progressing to something worse or limiting the quality of their life, as opposed to primary prevention, where I know what the cause of arthritis is, and I don't think we do, or correct me if I'm wrong. And so what we do is change the environment so no one gets arthritis. Our approach to lead, particularly as we realized it was affecting particularly little kids in particular areas of town, was to try and do something that changed those environments so kids weren't getting lead poisoned. However, for a bunch of reasons that work for this teaching case, I've kept this in the secondary prevention business. Okay. All right, so here's what we're going to do. And this is the way I still approach this with every client I get. The client feeds me a whole bunch of information on their program. Sometimes it's 2 pages like this. Sometimes it's a strategic plan or whatever. And I look for what sounds like what the program's doing and what sounds like who or what's supposed to change. So what's the what, the activities, what's the so what, the effects or the outcomes. And so here, probably as I was reading this, you detected these things. The program's going to do outreach, screening, case management, ID kids, environmental assessment, family training. Then notice that I said they're going to do referral for medical treatment and referral for environmental cleanup. Why? Because as we said, you can't use my money. This would be a lot easier program to be successful at if I gave you millions and millions of dollars and you found a kid and you had doctors on your staff that treated the kid, you found a house and you had professionals on your staff to clean up the house. That's not the way it works. That's just an expensive proposition. So you can't use my money to do those as activities. Well, can you do nothing? Well, you can try and do nothing, in which case you're never going to get that right-hand side, as we'll see in a second. So you fall into, I know what I can do. I can refer. All right. Now we'll see a little bit later that the word referral here solves our problem for the moment and then comes back to haunt us later if we're in the improving business. Right. On the right-hand side, I've underlined the 3 audiences I'm trying to change who are not me. I don't own any of these audiences. None of them are employed by me, but each of those has to take action from my activities to make the stuff at the bottom of column 2 happen. Right. Families have to do these techniques. Providers have to treat the kids or refer the kids for treatment. The housing authority or the landlord, I said housing authority because often in big cities, it's public housing where some of the lead poisoned kids live. Someone has to eliminate the lead source. All right. And that gets me out to my need, get that blood lead down, which the literature shows stops the developmental slide and presumably would increase the quality of life of the kid. Right. Now, one in maybe 24 times does this alone give me everything I need to have that discussion about evaluation focus? Almost always I need to take this next step, but be cautious. This is the first program I ever worked on in public health. And I ended up with a $500 an hour logic model. And I almost got fired because it was so useless to anybody but me who was very proud of it. What the client really needed was something much simpler. And they needed me to take these activities and these outcomes and spread them out into 2 or 3 columns. Let's say on the activity side, I had 2 columns to play with. Is there an order in which those activities have to occur? Logically. On the outcome side, is there an order in which those outcomes have to occur? Logically. Now, sometimes it's a time relationship, but we're talking about the logical relationship. There's some activities in here that have to happen first before others can happen. And so here's what we have. I haven't added anything, but you can see column 1 is where I get into the business of finding the kids that I put into case management because it's the secondary prevention. And that's when I can start to do all these other activities. On the right-hand side, you see the things I'm trying to get to as my need, get that blood lead down, stop the slide, quality of life improves. And in column 3, you see all the things that my activities are supposed to produce that tries to make that happen. Right now, in the case of lead poisoning, surprisingly, this was about as complicated as they needed to get because people didn't quite understand what was in our control and what wasn't. And they didn't have a good sense of how far to the right we had to get as a program to be considered successful with the money we were getting. And this was fine for that discussion, much more so than this $500 monster that I came up with. Right now, as I said before, there's a lot of advantage, particularly when you're trying to diagnose why a program is going well or poorly, or get consensus on how a program is supposed to work and what the underlying logic is, to putting in the boxes and arrows, what people call the theory of change or the program theory. And all that means is looking through here and saying, gosh, what leads to what here? Right. So again, if I had you for a couple hours, you would go in small groups and you'd say, okay, I'm going to move some of these arrows around. I think outreach leads to screening, blah, blah, blah. I've done that for you. So I want you to just take a look at this real quickly. Now, notice I haven't changed or added anything. I've just spread it out a little further. In this case, it's 6 columns, but that was totally arbitrary. I spread it out just to show these sort of pathway relationships a little better. So you can see I've drawn that dotted line where activities stop and outcomes start. And you can see now that column 1 looks pretty much like column 1 did in my table. Outreach leads to screening, leads to idea kids, leads to case management. Then I've got these 3 pathways, and each one of those kind of proceeds apace and converges on getting that blood lead down, which stops the slide, which leads to more productive or quality life. Now, remember, logic models are aspirational. I don't know that any of this is going to happen. All I'm trying to explain is I got all this money. What am I trying to solve? Why is the way I'm going to do it supposed to solve anything? And this is my picture of that. Right? Now, what's the advantage of this over this? Sometimes there's nothing, depending upon the conversation you want to have. But if this program is trying to say, gosh, what's the underlying logic of what we're doing? And do we all agree on it? There are 2 or 3 insights I get from this that I wouldn't get from that. And in the class, if I had you for several hours, I would make it as a wager and say, if I told you, if you got all the way over to here, meaning get the blood lead down and keep it down, I'll renew you automatically. And if not, you'll be publicly humiliated. Why would you be reluctant to take on that bet? And the answer people come up with is, oh my gosh, I lose control here and I don't pay off with my accountable outcome to down here. So the first thing that makes me a little bit reluctant is I lose control pretty early over the factors that get me to the success as it's been defined here. The second thing people come up with is, I haven't really said what this arrow here means. Notice there's 3 pathways here that get to reducing EVLL. Are each one of these an independent way to get there, or do all of them have to operate concurrently and together, right? If it was the former, gosh, I might take on the bet no matter what. The chances if this isn't working, well, maybe this and this will work. If this isn't working, well, certainly this and this will work. The reality is we probably need 2 of these 3 or all 3 of these. So that's a second complexity. Then the third complexity actually was raised by a student when I was teaching this. And they said, I think the hardest thing about this program is how do you find the how do you find the great case managers, the superhumans to do case management? And what they meant, and I hadn't intended for this to come across, but this really is ratified by the appearance of this logic model. Outreach happens, screening happens, ID happens, everything pancakes down on this poor case manager who suddenly gets 4 files on their desk. Everyone else goes to lunch, and then it's their job to make all 3 of these pathways happen for the 40 kids that we just found to be lead poisoned, right? That's a pretty steep hill to climb, right? Now, what do I get out of these insights? Well, I get 2 things. As an evaluator, remember, we're in the improving business. So our evaluation focus always wants to pay attention to what are the things that are going to keep us from improving or drive us into a ditch. Well, I just identified 3, right? One is making sure these handoffs happen. Secondly, making sure they happen with concurrency. And thirdly, making sure that I get superhuman case managers. So those are my 3 evaluation questions. Did the handoffs happen with did the handoffs happen? Did they happen? Did their results happen with, basically concurrently? And did we find superhuman case managers? Right? However, more importantly for us, and this is really what I learned at CDC, is people would come to me with an evaluation question, and what they really had was a strategic planning problem, all of which was because no one had thought through the roadmap. So the question here is, before I let this program out of the box, I've identified 3 things that could lead it into a ditch. Do I feel good about my ability to conquer that? Do I have these in place? Do I have a way for these to happen concurrently? What are my case managers going to look like? Right. And if that's the case, you're doing, I won't bother you with the fancy term for it. There's a term called process use, which basically means when the value of evaluation, this is so important when you're working with community-based organizations to sell them not only evaluation, but this idea of thinking up front is when the value of the evaluation is not the data you collect and analyze down the road, it's these early questions that help you identify from the start problems with the program you could solve right now. If I look at this and I determine, geez, Louise, I haven't done any of these handoffs. I don't have any case managers with any qualifications, and I haven't thought about concurrency. Well, I can wait 3 years for the evaluation to show that put the program in a ditch, or I can say, well, gosh, before I let this program out of the box, let me start working with this, right? So this is why I really preach this. This has been the main way in which evaluation has changed the way CDC programs operate, is that evaluators are at the table at the start, leading these early discussions on program description, et cetera. But often the yield of that is immediate changes, i.e. this process use, as well as coming up with some practical ways we're going to monitor the program over time, okay? All right, now, let me stop there and make sure people are with me. So there's not so much that's happened so far. We're in the improving business. The first role in improving is to make sure there's concurrence, there's consensus and clarity on what the program's about. Sometimes just this simple division of activities and outcomes into 4 columns is fine. Almost always, if it's early in a program, a little bit of this is going to go a long way. A very simple logic model that shows these pathways is going to be useful to you. Okay, so I'm going to give about 10 seconds for people to question, ask for elaboration or whatever. Then I'm going to turn to elaborating the logic model and evaluation focus and how those two things are related. Okay. Okay, so here's what we know already. We already know the activities and the outcomes. We know the sequencing of the outcomes on the right-hand side. So those first 3 things are our 4-column table we came up with. And then we know the underlying logic or the storyline, the program, the theory of change, the program logic of the program. That, as I said before, is probably 85% of the value of the program description step, right? But there's some additional value that's really useful, both as evaluators and as strategizers from some of these other terms. So outputs, I was really slow to warm to the term outputs, and I'll explain why in a second. But part of it is because I found clients would get really confused. Half the clients weren't sure about the difference between output and an outcome. The other half weren't sure about the difference between an input and an output. But the real reason I was not really happy with it is this is what we tended to get. So when we give money to our grantees, the outputs that would come back would be basically their activities with a number sign in front of them. And there's nothing wrong with it. If I give you a lot of money, I want you to be able to tell me that you did something with it. And yeah, I gave you money to screen. Yeah, I screened more than 0 kids. I trained more than 0 clients. I referred more than zero people. But remember, if the purpose of the logic model in this step is to show how the program works and to help you figure out where the program could right or wrong, it's almost never the case that the number of the activities, or the amount of the activity you do, is going to be more predictive of success. We're trying to get something very different from the outputs. So outputs are the tangible product of your activities. Remember, an outcome is a change in someone or something who's not the program. Nothing has changed here, but we're saying if I do all these activities, what are the tangible, concrete things I'll see that show those activities are underway, right? And the logic model really helps with this because the logic model reminds us why we do each of these activities. We don't do them for their own sake or to do them as much as possible as we can do. We do them to get that next thing in the logic model. So we're going to look at 3. We're going to look at screening, training, and referral. We'll see that we're in the screening business, not to screen as many kids as possible, but to find kids. We're in the training business, not to train as many families as possible, but to get those families to step up and do those very, very onerous activities. We're in the referral business, not to refer as many people as possible, but to refer them in a way that the kids we refer actually end up in medical management and completing medical management, right? So when we get this is not very helpful, right? And the reason this is not very helpful, or the reason I want it to be more helpful, is we're going to know the outputs way sooner than we're going to know the outcomes. If I give money to a bunch of programs, they're going to tell me how many kids they're screening, who they're training, how many referrals they're making, et cetera. Maybe the 3-month mark, the 6-month mark. I'm not going to know, did they get the blood lights down for a couple of years? And I want to know, if I'm in the improving business, as early as possible that the program is headed in the wrong direction. I don't know that, but well, I certainly know if they say I haven't screened anybody, trained anybody, referred anybody, obviously that's bad. But if they all tell me, holy mackerel, I screened 100 kids, I trained 90% of families, I made referrals for everybody, good on them, but it's still not telling me they're doing the right things in the right way, right? The logic model helps me by saying, how do I have to screen now that I know the purpose is to find kids, train now that I know the purpose is to get families to perform, right? So I call this the plot thickens. So if we think of training and self-management so good, it will lead to behavior change. That tells me a lot about how I need to train, knowing who I'm trying to train, the complexity of their lives, et cetera. And so I'm not going to want to know what percentage of families were in training Not that that's a bad thing to know. I want to know what percentage of families that got trained in a way that sure as shooting, if that's the way they're training, we ought to find them sustaining those behavior changes at the 6-month or 12-month mark. I don't want to know how many people they screened, or sorry, I certainly want to know that. I want to know, did they screen in a way that was going to help me find kids with that condition? Understanding that with lead poisoning, the kids in a big city who are likely to be lead poisoned, and therefore that's where you should be doing screening, are little kids living in the poorest part of town, right? So this is all that comes from that. This is a very short conversation, but a very engaging one. If you're close to an intervention, almost always when prompted, people say, yes, I know some good and bad ways to screen, some good and bad ways to train, good and bad ways to make sure that referrals are completed. If not, there's a huge literature on this, but the result will be something not a whole lot more complicated than this. For screening, the simple thing I want to know is if you told me you screened 1,000 kids and I gave money to 10 places and they all screened 1,000 kids, and suddenly, magically, a couple years later, half those places didn't find a single lead poisoned kid, and the other half found dozens and dozens of kids. Well, again, my algorithm showed there's some lead poisoned kids in there. I would like to have known 2 years earlier more about how you were screening, so I could say, I can tell you right now, if that's where you're screening and who you're screening, you're not going to find a single lead poisoned kid, right? If you tell me you're handing out brochures that tell moms and dads how to do the nutrition and stuff, I can tell you right now, those moms and dads are not going to sustain that behavior. I can tell you right now, you need to do something that's culturally competent and probably has some way of interacting with them, showing them, giving them access to the cleaning fluids they need, giving them access to how it is you get a little kid to eat spinach and kale and all those leafy greens that kids don't like. Same thing, if I give you a hunting license as a referral, I guarantee you, no one's going to find prey being in this case a medical treatment provider for their kid. These kids are little, they're poor, their doctors are overwhelmed with the other problems that they have and are almost always underpaid by Medicaid. What if I tell you, here's a hunting license, and by the way, here's 10 doctors we pre-qualified who know how to treat lead poisoning and have room in their practice, then I've set myself up for those referrals being fulfilled. So that's all this means. And again, it helps us in two ways. First, it helps us from the improving business, because if this is early in the game and I realize, I'm going to be screening in the wrong places, I can change. I'm training in the wrong way, I can change. I was going to refer by just giving people a pass, letting them go find their own doctor, I can change. More importantly, once this is out of the barn and people are doing the work, I can tell from the outputs they're reporting back whether or not they're headed in the right direction, and convince them to change while there's still time before they lose valuable time to get to their outcomes. Okay. The second part involves the other two elements of our logic model. So far we've talked about the logic model as, if I do things correctly, then I will get the outcomes I have in mind. But often what hurts me is not the inability to do the activities correctly. It's that I'm embedded in an environment that ends up being limiting in some ways. And that environment is something outside my control largely. So inputs and moderation context are two ways of thinking about the same thing. What's the larger environment in which I'm doing these activities? And what are the assumptions I'm making about what's in that environment that could get in the way of me being successful? So inputs are the resource platform for the program. They're the things I'm assuming I'll have in place to mount the activities, right? And for lead poisoning, it's pretty obvious. I need money, I need trained staff, especially that case management staff. I need legal authority to screen, but especially I need relationships with organizations for medical treatment and environmental cleanup, right? And why? Because I said before, referral would come back to haunt us. This is where it comes back to haunt us. A program can work by making referrals only if those referrals can turn into outcomes, which are medical treatment is provided, cleaning happens, only if the assumption that those relationships are in place is true. Now, same thing's true of legal authority to screen. You can't go in and even deal with the kid with lead poisoning unless you have legal authority from the legislature, but everyone does pretty much. Funds and trained staff, sure, those aren't killer assumptions. They're limiting assumptions. I can't do as much if I don't have the money. I can't do as much if I don't have the trained staff. But the lack of relationships is a killer assumption. The program can't work unless those relationships are in place. All right. Now, why do I want to know this? Again, there's a process use reason. The program's not out of the barn, and I know I don't have those relationships, and it's clear from the logic model the program can't happen without them. Obviously, I don't do the program until those relationships are in place. From the point of view of evaluation, looking retrospectively, making sure that I measure those relationships helps me explain, especially if I gave money to a bunch of different cities, why it is probably the reason that it worked in some cities and it didn't work in others. Or as I'm finding out that they don't have relationships, can remind them, by the way, this is headed for tragedy. This is headed for a cliff if you don't make those relationships happen. Right? Moderators are the exact same thing, but moderators get more at that larger picture. So inputs are the things that are in your face. Do I have the money? Do I have the staff? Do I have the organizational relationships in town? This is their political will. Context is more the big things in the larger environment. And we think of it in four kind of varieties, not because we're looking for problems in every one of these, but this is a handy way to look at the environment in which my program is planted and make sure I'm not overlooking some really huge assumption. So it spells pest. I inherited it this way, but I think pest is a good mnemonic for it because it reminds me sometimes my programs fail because of things that are out of my control in a larger environment. And so knowing this and looking at this in advance tells me forewarned is forearmed. Is there something political that I'm assuming that's not true? Economic, social, technological. And for lead, this is the typical ones. If I give money to 10 places, they do everything right on the activity side, but some of them really make a difference in getting lead poisoning down and others don't. Almost always, it's going to be one of these three things that explains the failure. Politics, hazard politics. Does anyone care about lead in that town? Or are they totally so consumed as a housing authority with asbestos, toxic mold, or whatever? Economics, you can't make this happen unless you find someone to treat the kid, right? What if Medicaid is overwhelmed? What if there are not enough Medicaid providers? What if no one's going to take on an uninsured kid because these kids are always poor kids, right? Then I know in advance, I've got to solve that health insurance gap. Right. And then there's some things on the technological side that are peculiar, especially in global issues. Often technology's in the way. Hang on a second. Let's see what the chat is here. Oh, yeah. Someone just has to leave and is thanking me. All right. All right. In this case, in technology, you can't treat a lead poisoned kid unless you confirm their lead poisoning. So you take a finger stick like you would for anemia. If they look suspicious, then you take a venous blood draw. And yet we lose half the moms and dads walking from the doctor's office down to the lab to get that venous blood draw because getting a venous blood draw from a little kid is pretty torturous to watch and probably torturous for the kid to experience. A new technology does it all in one sitting. You just take it like you would for a diabetic, but it's very, very, very expensive. So you can imagine how big a difference the presence or absence of this technology or the means to afford it can be in your success. Right? So again, what do we do with this information? Same thing. If the program's not out of the barn yet, and I say, these are three big moderating factors that are going to kill me, I'm okay on politics, I'm okay on economics, I don't have any of that money for that new technology. Well, I can take action at the start, right? On the other hand, if I'm doing this retrospectively, these gives me three reminders. If I'm not getting the results that I'm looking for, these are three places I want to make sure I'm probing to see if I could be doing better. The important thing about this is in the old days, people would put the moderators at the bottom and there would be their box of excuses. How can you expect me to make the progress you want me to when we have all of these problems? The more important thing, and again, this is why it's so important to have a roadmap, is mapping these moderators, to the roadmap. Look at this, hazard politics is a big deal, but it affects primarily that northern route. Insurance climate is a big deal, but it affects primarily that southern route. So if I can't solve it, then I still have the option of asking myself, is there a way for me to get over, to reducing those blood leads by using only 2 of those 3 available pathways? So you can see how this ends up being a much more empowering way to think about this. All right. So remember, all of this just helps make the program theory clear. It doesn't make it true. Now, it makes the program better in a process use way. In the course of doing this, you may realize, geez, I don't need to collect any data. There's 2 or 3 things immediately wrong with this program I got to fix, and I got to fix them now. But whether that happens or not, when you step out with your clear program description after thinking through these inputs, outputs, and moderators, what it does is it gives you a better shot at having a program be implemented that's going to be poised for success, poised for improvement. Okay. Now, how do we put all of this work we just did? I spent a lot of time on number 2. Let me show you how step 2 then makes steps 1 and 3 much easier. Make sure how I'm doing on time. Okay. So remember, you do the steps in any order you want to. I always start with step 2 because I think then you back into step 1 and step 3 and they go a lot better. All right, so let me show you how. So engaging stakeholders. I have my logic model done, and I'm going out and I'm looking for the key stakeholders to involve. And then when I say the logic model is done, when I do logic models in step 2, I often do them on the back of an envelope. I do something just to show I haven't locked this up. I'm just trying to get a discussion started, right? Then who am I going to talk to? Well, I'm going to talk to 3 major groups: people served or affected by the program, people involved in the program operation, which is going to be the partners and the staff, and then the primary intended users of the evaluation findings, right? The trouble with that is that's an enormous, enormous number of people, right? So what I say instead is, who do I most want to focus on? So if you look at these factors in the lower box, you'll see they're inspired by this idea of utility, feasibility, accuracy, et cetera. Right? So I may end up with 1 million people that show up when I ask those 3 broad questions at the top. The stakeholders that matter most are people, and there may be none of them that I need to worry about to enhance my credibility. Could be I'm on the side of the angels, everyone loves me, but often that's not the case. Implementing program changes. We talked originally about how utility-focused evaluation is all about who's going to implement this and do they agree with your take on the program. Likewise, advocating for changes. As a public organization, we can't do our own advocacy. So who do we need to engage that can take these findings to heart? And then, of course, the first one, I put it last because it's often the only person we think of is who funds and authorize the expansion of this program, right? So the first thing you're asking yourself is who falls into those boxes? And then the more important thing is what are they most interested in that constitutes success for the program? And you can see how important that is because that could feed, that you've got a big gap missing in your program. Your program's not even poised to produce an outcome of interest to them. Secondly, obviously, it starts to help flesh out that evaluation focus by asking questions that matter to the stakeholders. Now, here's the cool thing about it. Stakeholders, I think, is overdone. Logic models are overdone as well. I find so many over-engineered logic models where people are sprawled on the floor exhausted from doing these very complicated logic models when something really simple would have been fine. Likewise, I find people sitting and just spending so much time thinking about every available stakeholder because they're so worried, when in reality, just thinking about the highest level stakeholders that fall into these groups is often just fine. The reality is, I'd say in 80% of the case, stakeholders agree with us mostly down that cascade. And sometimes we don't get disagreement until we get to that 3rd bullet or that 4th bullet, right? Do they agree or disagree on the activities and outcomes depicted? Well, if not, that's why you're doing a roadmap, to make sure they do. Do they agree on the roadmap, i.e. the pathways? If not, that's what you're doing. Number 3 is the most important bullet of all. Do they agree with you on what constitutes program success? And invariably, you're going to find some do and some don't. Well, you want to know that early in the game. That really defines everything you're going to do about program improvement and how you're going to measure things. But typically, when you get to the last 2 is where you'll suddenly start getting into some issues you need to resolve with data collection or data analysis. How much progress on outcomes equals program success? We all agree on this metric of success, but does it need to be 0 defects? Does it need to be a 10%? Does it need to be, we got to make sure that's at least occurring equitably across genders or races or whatever. And then finally, this issue of quantitative, qualitative. What kind of data do we need to collect for the results to be persuasive to the people that matter? So these are the kind of questions you're asking. None of them are brain surgery. These are things you would ask routinely anyway. This just gives you an organized way of doing it. And as a result of it, you can answer this is a handy dandy sort of Mad Lib to help you think about it. I need this stakeholder because without them, I'll lack credibility, implementation, funding, or advocacy. So that's the who, right? And to keep them engaged as the project progresses, I'll need to demonstrate what activities and outcomes. And so that's where this comes in, right? So this helps us identify who. This helps us identify where the area of disagreement is. And that's what leads us to the filling in this Mad Lib. Here's my stakeholders. Do I really need them? Maybe, maybe not. Oops, I really need these handful. And each one of them has a slightly different need, most of which I was probably already going to take into account in my data collection and my focus. But thank God I found out that these guys are really interested in the cost of everything. That was not something I was going to worry about. Or they're particularly worried about the effect on employability of parents or something, some other artifactual thing. Well, I want to know that early in the game. Right? So in this case, there are three big stakeholders for lead poisoning program: providers, neighborhood organizations, and funders. And if I had you, I'd kind of let you think about how mapping through here what the interests are of each of these 3 groups. And you might conclude from that their needs and their success measures overlap, or they have very different ones. And then we would decide together how that affects our evaluation focus. Right? In each case, we'd be filling this Mad Lib. I need providers to provide or enhance credibility because they'll convince other providers to also participate. And implementation, they're going to implement that really key thing. Neighborhood organizations, I'm going to need them for credibility with the families, so they'll come to the training, they'll follow the recommendations, etc. And what are they going to want to do? Well, hopefully success to them means the same thing it does to providers, or I want to know that up front. Okay. Right. Now we turn to focus. Now, again, you see, we've already talked about focus twice. Remember, if we're in the improving business, the focus needs to be on those things that could most lead us into a ditch. And we've already, in these other 2 steps, found a couple things that begin to populate our focus. First, in the logic model, I said, okay, gosh, where could this program run awry? And we found 3 things: superhuman case managers, doing the handoffs between those 3 activities, and people who needed to take action, whether it was landlords or doctors or families. And then this idea that it had to happen pretty concurrently. Right? So those become 3 questions that show up in our evaluation focus. The stakeholder piece is where we also identified, boy, if I want to keep stakeholder A, B, or C at the table, I'm going to have to ask question X, Y, or Z, because that's the thing they're most interested in. Right? So step 3 is just sort of a test. It's a reality check to make sure we're asking the right questions. And it could be that we'll flesh out and find additional questions worth asking, or it turns out, holy mackerel, I already landed on the right ones in thinking through those first 2 steps. Right? The important thing about a focus, and this is why it's so empowering, is sometimes you'll lose clients to evaluation because they'll play along with the logic model part, but then they'll get scared because they think that every single box and arrow in the logic model has to be part of the evaluation focus. And that's not true. It probably does need to be part of evaluation plan. If I give you a lot of money, the program's going to be around for 10 years. It's probably the case at some point in those 10 years, you're going to be asked to show that this box occurred, that box occurred, this arrow occurred, that arrow occurred. But the evaluation focus says at any point in time, what are the important questions to ask? And that is always changing. The important evaluation questions you're going to ask at year 1 of a program and year 10 are invariably very different. And so the question here becomes, how do you make that decision? Right? The standards are really where we come into play. I'm sorry, let me do one thing. I overlooked one thing. Okay. And when we think about evaluation focus, typically you'll find that people use some of the terms that you see in this simple table here, and particularly the ones across the bottom. So we think of evaluation as having a bunch of different flavors to it. So needs assessment evaluation, which some people call formative evaluation, which gets confusing with these phases of formative and summative, but basically is evaluation that happens before the program begins. I have a problem, I'm trying to solve it. What does the literature tell me? What does the situation tell me about where the devil lies in the details? I turn all of that into a program, and then the important questions I'm asking are process evaluation questions. Can I get this program implemented the way I want to? And I'm not necessarily interested in, is the program working or not? I'm just interested in, could I get it implemented as I intended? As the program progresses, then people have the right, and I'm certainly more curious about, did I get any of the outcomes that I've been thinking about? And then as the program really matures, I'm thinking more and more downstream. Are there some big distal outcomes, something that looks close to my need that I should be seeing some change in, right? Now, the cool thing about this is it's the rare evaluation that's asking questions in all 4 of these domains concurrently. So the evaluation focus steps using the standards helps you decide right now, what are the most important questions to be asking? Is it a mix of process and outcome? Is it primarily outcome? Is it primarily process? So, as I said, in the old days, utility was our, accuracy was our guiding standard. And we tended to have very, very process-oriented evaluations because that's what we could collect information on validly, reliably, and accurately. People just scorned us for saying, oh, you're just bean counters. And so we said, okay, we will do no evaluation unless we have a utilizer in mind. We will always meet the needs of the user. And that means making sure that the purpose, user, and use of the evaluation results are known before we get into the evaluation. Now, you're going to see in a second that comes back to haunt us, but for the moment, it's really, really good advice. And this governs 80% of how we set the focus. Right? So here's some potential purposes. And as you go through these, you'll see that none of them require you look at every part of the logic model. Each one migrates around the logic model. So one purpose of an evaluation could be testing program implementation. We'll see in a second. That's going to live mostly on the left side of the model. Show accountability is going to mean Congress wants to see, did you get what I paid you to get? And that's going to live mostly on the right side of the model. And then continuous program improvement lives solidly in the middle. I want to do my program. I want to understand early in the game that I'm heading in the right direction or not, because I want to be able to change for the better. And so I need to know both how I'm implementing and probably a little bit about, am I getting some of those early outcomes, right? So those first 3, you can see they migrate around to different parts of the logic model. That 4th one is not about the part of the logic model. That's more about the rigor with which I need to ask these questions. If I'm trying to increase the knowledge base, then I'm interested in a much more rigorous evaluation approach to prove my program led to my outcomes. Or if I'm trying to increase the knowledge base of best practices, then I want to look at the relationship between the inputs and the activities in a much more deep and thorough way, right? So testing program implementation is always going to live on the left-hand side. right? And the kinds of questions we're going to be asking are the type and quantity of services, the implementation fidelity, could we meet the high bar, how many people got services, how much money and staffing, et cetera, et cetera. So those are really obvious ones. Now, people are dismissive of this because for so long, it was all that we tended to do in public health. And everyone would say, well, gosh, but what did it buy us? What did it buy us? What's the so what of what you did? And so people tended to be dismissive of process evaluation. But remember, half the time, we're not going to get the outcomes that we're really looking for, or as much of the outcomes as we're looking for. And unless we have process evaluation to help us figure out what went wrong, we really can't answer that question for program improvement. All right. So here's a good scenario, as a good example. It's year one. Other communities want to try my lead poisoning program, but they want to know what they're in for. Okay. Now, sure, they'd love to know after 1 year that I cured lead poisoning in my town, but that's a pretty unreasonable question. But there's still a lot of other questions they'd like to know. Before I decide to do this myself, how hard is this to do? Should I do it or should I run the other way? So purpose, examine program implementation, the users, the other community, and the use is to make a determination based on my experience whether they want to adopt this project in their town or run the other way. The question of does it work or not is not as important at this point as is how much pain and suffering is involved in getting this implemented. Right? And this is where outputs are going to be useful to us, right? If in fact we have asked those output questions, then they already know how to pose it, right? Were you able to do those trainings in a way that set you up for families to complete it? Were you able to do screening in the parts of town that were likely to get you to the right kids? Were you able to find providers to refer to, or was that going to be hopeless for you? So this is where outputs become a really big part of that equation, right? On the other hand, when you look at 2 and 3, now you're getting into the outcome field, all right? People are maybe interested in how we implemented the program, but they're far more interested in did we get any so what out of it? And again, in accountability, Congress is paying us to get that stuff pretty far over to the right. In continuous program improvement, we want to get over to the right, but we want to know early on, if we implement the program correctly, do we even see some of these first fruits? Because if not, we want to take action right away. All right.
I hate to interrupt you. There's a question that's been in the chat for a while, and I see that our time is going to start winding down quickly. I'm wondering if when you hit a spot where we could open it up to questions.
Yeah, let me get a couple more things done.
Okay.
Here. How are we doing on time here?
Yeah, we have 12 minutes left.
Okay, great. Yeah, let me just make 1 or 2 more points. Okay.
All right, thank you.
Okay, so here's where the balance in your focus needs to balance utility against feasibility. When we got into the utility business, what we found out the hard way was that a lot of stakeholders are not familiar with public health, how hard it is to implement public health, what a realistic expectation of a public health program is. And so they would ask questions that were really, really important questions to them, but were not terribly reasonable. And they were not reasonable for one of 3 reasons. The stage of development was too early. They were asking a question, but the program hadn't been around long enough to make that happen. Or they were asking the question, but the program was never going to be big and bold enough to make that happen. The first project I ever did for public health was we did an 8-panel brochure called Understanding AIDS that went to every American household. It was intended to provide information on how you could and couldn't get AIDS. This was in the late 80s. And there was a lot of misinformation around. There were members of Congress who wanted to know how much that reduced the rate of HIV. Well, that's a completely unreasonable expectation. It wasn't program development. It wasn't like, oh, it might take a couple of years, but people are going to read that brochure. By the 3rd time they read it, they're really going to get it. It's a brochure, really should not be about changing behavior. It should be about informing awareness. And then resources. A lot of times you're asking something that's going to require a lot of resources, and you don't have them without robbing the intervention. So these are 3 reasons, but you can see how you want to do this at the start. What is it that people want to know? What do your stakeholders want to know? What are the utility questions you want to know? And do those questions pass muster for this evaluation this time based on stage of development, program intensity, and resources, right? And again, this is where, so scenario 2 here, it's year 5, you want to get money from the legislature, but so does everybody else. Well, very clearly, you're going to need to muster evidence to show why they should give money to you as opposed to someone else. And that's going to be somewhere over on that right-hand side. Now, it's probably not going to be over here and showing these kids went on to have productive and quality lives, but it's certainly probably going to be to show at 5 years, I got the blood lead down and kept it down. And to close this loop, this is where our outside factors come into play. If I go into a legislator and I say, we got the blood lead down, we didn't do as well as we were going to, but thank God I looked at these questions of moderators and I realized the thing that got in our way was we didn't have that strong alliance to take lead seriously among policymakers or whatever, right? Right. So clarified relationships of activities and outcomes, identified inputs, outputs, and moderators. We just went through how those help you set your evaluation focus, got clarity and consensus, and identified a really strong focus for the evaluation. We still got a lot of stuff to do, but all those standard things become a lot easier because we did those first 3 steps that we talked about today. All right, good. Let me stop there. We have at least 10 minutes for questions. If we only have 9, if I'm reading this correctly, we only have 9 participants. I think it's fine for people to either put it in the chat or just take themselves off mute and ask.
Right, so there's one in the chat thinking about potential funders and moderators, worried about naming all the potential how naming all the potential barriers might eliminate funding opportunities.
Yeah, I mean, again, there's a question of like who you disclose all of this to and who's involved in the discussion. But remember, if it turns out there's a big moderating factor out there and it's not going to change, well, you can ask for money from the funder, especially if you're going to leave town before the program's done and people realize that it didn't work. But the reality is you want to identify these you're not looking for every single barrier. You're looking for what we call killer assumptions. Is there some assumption I'm making about the moderating environment such that if that assumption is not true, the program simply can't work? So if I get money from CDC to do lead poisoning, I know I can't use that money to clean up the kid or clean up the house, and I don't have a single relationship for that. Well, yeah, I mean, I guess it keeps me in room and board for a couple years as a human, but the reality is the program simply can't work. Now, whether you disclose that to the funder at the start or not, or the funder is looking at it saying, by the way, I don't see any effort here to form relationships, I'm not giving you any money. This is intended, again, primarily as a process use insight early on in the game. What do we need to do for this program to be successful? And then we, of course, change our statement of work to include that. Or where you're not sure these relationships are going to work, making sure that you include those and explain to the funder why you're including a continual examination of that partnership environment. Okay. Yeah, but how much of this you disclose versus how much you sit there and you just, okay, here's a bunch of things we're going to need to cross our fingers about. But again, forewarned is forearmed. Whether you disclose it to the funder or not, you're thinking to yourself, man, let's get this money. I think we can solve this. But note to the file, we got to be out there hustling to get those relationships. Okay. Other questions? And I want to emphasize, if this looks like it's relevant to something you're working on now, just write me separately. Again, I laid out the full Monty here, but a little bit of this goes a long way. And question by question, I don't want to fall into the same gap of being dogmatic about doing all these steps in all the same way, because that will just lose clients the same way that the old way of doing scientific designs did. So a little bit of this goes a long way. And if it looks like you got something you can where this can be useful, just write me separately. We'll talk a little bit more about what parts of what I talked about today are going to give you the most bang for the buck. Okay, any final questions?
A question in the chat. For students interested in an implementation science and moderating and evaluation career, what segment should they focus on first?
Oh, okay. An implementation science and career, what segment should they focus on first? Implementation science enjoyed a considerable resurgence of interest. And the trouble is, when implementation science means I want to pay as much attention to why programs don't work as why they work, how to make them work again. It's cool. Implementation science, as it enjoyed, as it discussed the last couple of years, I thought just got into really heavy, over-engineered sets of questions. I would say if you're trying to get into an M&E career, okay, let me say it this way. I think implementation science is not going to teach you as much about how to get to outcomes as trying to get to M&E and outcomes will teach you about what to look for that goes right and wrong with a program. So I think I would spend most of my time and attention in an M&E career, unless you're going to go be a researcher, on trying to understand the basics of monitoring and evaluation, get a good handle on how to create good performance measures, because those serve both implementation science and M&E, the perils in data collection, and then particularly this issue of how do you keep the client or the people running the program or the people participating in the program actively engaged in those. All of that's going to be very, very good background, whether you take an implementation science route or an M&E route. And I think on the ground as practiced in an organization other than a think tank or a university, these things are probably terms you'll keep in your own head as separate, but as displayed with the people you're working with, they'll be all those things will be mixed up. And I don't know that someone will really understand when you're talking about implementation science versus monitoring and evaluation.
I put your email information in the chat.
Oh yeah, absolutely. I think it should be on the first slide, is it?
And right, and I'll send the PowerPoint to everyone once
Yes.
I get it from you.
Correct. And I'm at CDC now. I don't know which email I put on the first slide. I have a Gmail one, which is probably better to use just because my involvement with CDC really ebbs and flows depending upon whether I'm doing a guest researcher slot or not. But
why don't you send it to me with the slides and I'll forward to everyone who attended.
Sounds good.
All
okay.
Right. Well, unless there are other questions, thank you all for attending. Thank you so much, Tom. This was so rich of information. Yes, have a good rest of the day, everyone.
Thanks very